Welcome to proactivephysioknowledge.com. I am Jamin Bhatt, and in this video I am going to discuss about the trapezius muscles. Why I choose this topic? Because last week I had a patient who came to my clinic with a severe neck pain. He has a pain since 2 years with taking the treatment months and months from the physiotherapy colleagues. Many of times we feel that why trapezius is tight, why choose the taping technique. Many of times we apply the tape to the upper fiber of trapezius and we bias the lower as well as the middle trapezius exercise, and we directly blame that the patient trapezius is overworking. In our rehabilitation process, we are not isolating a specific muscles for the exercise part, because the brain actually recognize the movement rather than isolated muscle movement. So whenever you are working on an exercise, you are not isolating, you are not doing an isolated exercise of the particular muscles. Well, if we look at some robust studies, there is no doubt if you have somebody with a frozen shoulder, because they simply don't have the range. Their only strategy is to elevate the shoulder and overuse those scapular muscles. Likewise, if you think of somebody with a massive rotator cuff tear, then who haven't compensate well, a common feature is increase the activation of the upper fiber of trapezius. There is no doubt if long thoracic nerve injury compensation, then again you should expect that a trapezius to be working harder in that type of patient. Now, the upper fiber of trapezius doesn't work in isolation. It works with the force couple with serratus anterior, rotator cuff muscles, middle trapezius as well as the lower trapezius. So, if you think that the upper fiber of trapezius works alone, it is totally wrong, because muscle is not work in a isolation part. So, in this study, Ludwig that certainly concluded in his abstract that patient who had Ludwig et al. Had done a good study and certainly concluded that in his abstract, patient who had a subacromial impingement syndrome did have a overactivity in their upper fiber of trapezius. Now this sounds quite convincing until you drill down to the detail. So author actually reported that the upper fiber of trapezius was actually overactive in a later degree of elevation. We also have had a lot of EMG studies from the NCOOLs. They did a surface electromyography analysis on the 55 healthy participants with the age group of 18 and 16. And they conclude that there is an increase in activity by 100% of the maximal voluntary isometric contraction in the 8 shoulder girdle muscles. So again, we have to be honest and recognize the limitation of EMG, and actually what increase the activation level tells us. Are they genuinely telling us that the muscle is working harder because it is doing a too much work, or simply there is a compensation of the particular group of muscles? When we look at the systemic review of the EMG studies, there are a key difference in the patients with pathology which compared to the normal population. So the bottom line is there are some key themes, but there is a huge heterogeneity across the different population. But you actually look at the anatomy of upper fiber of trapezius rather than having these very vertical fibers that would give you a pure elevation. They are actually quite transverse in that direction. Trapezius doesn't have much of an elevation effect on the scapula in the initial phase of elevation. Now the interesting thing is that when you bring your arm in a scaption position and then do a shrug, that is a much better relation contribution of the upper fiber of trapezius. When you see the patient with a droopy shoulder type of posture, who complains of neck pain, who is also complaining of trigger point purely because of upper fiber of trapezius, which actually are weak and need a bit of encouragement to work harder for the muscles. Now, there is also been some other work done by the Lees group. This paper was published in 2016. They extensively look at not only doing the slight abduction position and the shrugging, but also they add a craniocervical flexion at the beginning of the movement. They conclude that just added the craniocervical flexion before they did the shrug exercise of the shoulder joint, they got even better effect on the trapezius. Now, if we just do the elevation through range of motion, we get the really lovely contribution and the balance activity of all the elements of the trapezius as well as the serratus anterior muscles. So, Birgit did a lovely study looking at the way of targeting trapezius muscles without getting undue activity in the levator scapulae. And they showed that this elevation through range of motion in the scapular plane, which is highly effective way for targeting the muscles. And also, they also showed in the same study, if you have got the patient to do a shrug above the head, you have a nice activation of the upper fibrous trapezius and again some balance activity of the middle as well as the lower trapezius muscles. In summary, we don't need to really drill down to the detail unless we have had a nerve injury or actual muscle injury, because the brain recognizes the movement. Muscles are designed to work together, and actually we just exaggerated the initial onset. If you like to really help to get trapezius going, then we can select the exercise that specifically get all the scapular muscles as well as the rotator cuff muscles get strong enough. So I hope that gives you a little bit a tip about upper fiber of trapezius.